So where are you going?
Home. My sinuses are really acting up.
Did you take anything for it?
No, but every time I get a cold or the weather changes, I get these terrible sinus headaches. If I take medication, I either get too sleepy or too jittery. So I think I'll just go home and lie down.
I used to have the same problem until my doctor recommended this. You should try this.
What is this SinuCleanse?
It sounds strange at first, but it's a way to wash the drainage and congestion right out of your nose. It only takes a minute, and I can use it as often as I need it. And I really like not having to use all those expensive prescription medications. You should try it.
How does this work?
Here, look. I've been working on a presentation for my doctor to show her patients. This should explain everything.
Sinuses are spaces in the bones of the face. There are 4 sets of sinuses: in the cheeks, between the eyes, in the forehead, and 1 in the back of the nose. It is normal for the sinuses to produce thin, watery mucus about a quart a day in an average adult. This mucus soothes and lubricates the inside of the nose and throat. The mucus needs to flow out of the sinuses into the nose through small openings connecting the sinuses with the nose. Once in the nose, the drainage flows backwards down the throat and is swallowed. As long as the mucus stays thin and watery, you don't detect it running down the back of your throat. If the mucus gets thick, however, the sensation of post-nasal drip occurs. Thick, post-nasal drainage can cause throat clearing, cough, bad breath, and sometimes even nausea and vomiting. The sinuses are lined with microscopic hairs called cilia. The moving cilia direct the mucus out of the sinuses and into the nose. The delicate cilia are easily damaged by infection, allowing thick mucus to pool in the sinuses. This causes feelings of facial pressure and sinus headache. Nasal washes are a way to thin the mucus produced by the nose and sinuses and improve drainage. Nasal washes contain no medications, so will not interact with other treatments your doctor recommends. The solution used to wash the nose is important. The lining of the nose is delicate and easily injured. The SinuCleanse solution has been specifically formulated and medically proven to improve nasal stuffiness and thin nasal mucus. Specially packaged natural ingredients are available in convenient pre-mixed packets to make fresh solution each time you use SinuCleanse. Water directly from the faucet can be used. The water should be lukewarm to the touch. Cold or hot water will feel uncomfortable in the nose. Mix the water with the dry ingredients, adding water to the line on the side of the SinuCleanse pot, and stir until the dry ingredients are completely dissolved. To use the SinuCleanse pot, stand facing the sink. Put the spout into one nostril and tilt your head forward so you are looking into the sink. Breathe naturally through your mouth. Tilt your head away from the pot and lift the handle of the pot, pouring the solution into the nostril. In a few moments, the solution will begin to drain out of the lower nostril into the sink. Allow the water to run completely out of the pot into your nose. The thick mucus in your nose will thin out, and the lining of your nose will be soothed and rejuvenated. Once the pot is empty, gently blow the excess water and mucus out of the nose into the sink and tissues. Avoid vigorous nose blowing. Refill the pot with another packet of SinuCleanse dry ingredients, fill with water, and repeat the wash starting in the other nostril. With your head in a proper position, you should be able to breathe comfortably through your mouth during the wash, and the solution should drain into the sink, not run down into your throat. The nasal wash can be used every day or more or less frequently depending on the individual. Using SinuCleanse will not interfere with the use of other medications or treatments. If your doctor recommends prescription nasal sprays of any kind, the nasal wash should be done before using the spray. Cleaning the mucus out of the nose will allow the medication to be more effective. The SinuCleanse pot is top rack, dishwasher safe, and should periodically be washed to keep it clean. SinuCleanse was designed for use in people of all ages. Every family member who does nasal washes should have his or her own pot to use to avoid the spread of germs. Nasal washes can be done by anyone capable of blowing his or her nose. Children can do nasal washes with adult assistance and supervision. If you are experiencing difficulty or discomfort doing a nasal wash, or you are experiencing nosebleeds, pain, or drainage that persist, you should see your doctor rather than continuing the washes.
You did a great job on that presentation. I'm sure that the doctor will really like what you've done. In fact, I'm sold on SinuCleanse.
Lisa, you'll have to get your own.